Hello, everybody. I'm going to talk to you today about some biological factors as causal explanations. So, the prevention of placing children at risk for physical and mental health problems, that's going to start as soon as someone gets pregnant, at the onset of pregnancy. So, at my school, from my personal experience, we have triannual reports, reevaluations, every 3 years for our students with special needs. And our school psychologist will send home a parent survey to all the parents of those students. And in that survey, there's questions for the mother indicating whether they had a healthy pregnancy, asking questions if they smoked, drank, or took any drugs while the student was pregnant. And our school psychologist will always incorporate this into her reports. So we know for sure that this is very important. The pregnancy is very important for indicating any behavioral disorders maybe in the future. Other physical problems, poor nutrition, which I'll get into in later slides, things like lead poisoning, that can also have a negative effect on a children's behavior when they get to school. So in the last 10 years, we've seen lots of significant reversals in health indicators that affect children. So a study by Baumeister, Cupstas, and Clinworth suggested that without prevention efforts, there's a quote-unquote biological underclass of children. Their problems that they have, a lot of them are related to things like poverty, prenatal care, and the prevalence of chronic illnesses, and I'll get into those. The first one's poverty. There's plenty of different theories explaining behavior differences among children, and one of them is that genes, along with the environment, play a major role in behavior. So a lot of behavior geneticists agree that DNA will count between 30 and 50% of our behaviors, which leaves room for 50 to 70% that's explained by the environment. So obviously, living in a poor environment, low socioeconomic area, is going to affect the child's behaviors. So from personal experience, the school I teach at is in Bunker Hill, West Virginia, and then I also run the after-school program and work at the Boys and Girls Club in Martinsburg, West Virginia. Bunker Hill is more of a rural area, and Martinsburg is more of a urban area, but both places have very high poverty. And something that I've noticed making phone calls home, maybe having to suspend students at the Boys and Girls Club, things of that nature, both at school and at the Boys and Girls Club, are students that that are in poverty are more likely to have behavioral problems, more likely to have phone calls home, more likely to get suspended, things like that. One way I know this for sure is students have their contact forms, and on there it'll say things where the parents work. And a lot of these parents indicate that they are unemployed. A lot of them are single-parent households. A lot of them work low-wage jobs, maybe don't live in the best area, and that is affecting the behavior of their children. The next issue is prenatal care. Prenatal care is very important for keeping both the mother and the baby healthy. So babies of mothers who get prenatal care, who don't have prenatal care are 3 times more likely to have low birth weights and 5 times more likely to die than mothers that get that care. So having that healthy baby, getting those prenatal care is going to help have a healthier birth, which is going to help prevent any behavioral disorders or emotional disorders. And the third thing was chronic illnesses. So one study showed that students that suffered from chronic illnesses, they had elevated levels of internalizing as well as externalizing problems. And overall behavioral disorders were up as well for students with chronic illnesses.